I once had a patient who told me that she had been going for therapy. I said, therapy? What therapy? What is therapy? And she said, physiotherapy now, not therapy. I said, wait, I'm not sure you were going for physiotherapy. She said, the person used to call himself physiotherapy now, physiotherapy. I said, wow. I said, does the person have a license? He said, no. That was when I knew, oh, this is a problem. Before you allow anybody to touch your body for therapy, please ask them one question. Where is your license? Because in Nigeria and across Africa, many people call themselves physiotherapists or therapists without training. See, physiotherapy is a regulated medical profession. We go through the university training, clinical posting, and licensing. So if someone cannot show you a license, registration number, or recognized qualification, they are not a physiotherapist. Your health is not for trial and error. Please ask for their license. It is your right as a patient. I once had a patient who told me that she had been going for therapy. I said, therapy? What therapy? What is therapy? And she said, physiotherapy now, not therapy. I said, wait, I'm not sure you were going for physiotherapy. She said, the person used to call himself physiotherapy now, physiotherapy. I said, wow. I said, does the person have a license? He said, no. That was when I knew, oh, this is a problem. Number 2, native massagers can never cure stroke. Let me say this clearly. Massage cannot cure stroke because stroke is a brain injury. The problem is not in the muscles, it is in the brain. Massage may relax muscles temporarily, but it does not restore brain pathways. It doesn't restore balance. It doesn't restore coordination or function. Only structured neurorehabilitation like physiotherapy can do that. Truth is, if massage cured stroke, hospitals would prescribe massage. However, stroke recovery requires programmed exercises, in fact, it's a whole routine of what to do. I see all these videos of people massaging the hand, massaging the leg, and it reeks of ignorance because the problem was not even the hand. You are massaging a hand because it's weak. You don't know that it's the brain that controls the hand. When the brain signals the hand to be fixed like that, there's nothing you do here except you start teaching the brain how to correct it. So the brain was the problem, not the hand, not the leg. But they don't know now. That's why I'm here, so you will know, so you don't go to quacks. Number 3 is that all therapy is not the same. See, all therapy is not the same, and confusing them is dangerous. Physiotherapy treats movement, pain, stroke, injuries, and disability. Massage therapy, on the other hand, focuses on relaxation and soft tissues. Cognitive behavioral therapy or psychotherapy treats your thoughts, your emotions, your mental health. So calling people therapists, you have to know which therapist are you talking about. So know who you are seeing per time. The right therapist, physiotherapist, his job is not to come and massage you. If you need a massage, go and tell a massage therapist. Okay? Number 4 is that when you are sick, who do you listen to? Traditionalists or medical doctor? Are they all doctors? A colleague of mine told me how that one traditionalist who came to the hospital for treatment was telling him how that he's his colleague, they are all doing the same thing, they are all doctors, and he thought it was a medical doctor, only to realize later on that the man was a conk traditional herbalist. I was telling the doctor that they are doing the same thing, they are all doctors. So are they? Who do you listen to? Who do you take advice from when you are sick? Traditionalists rely on belief and experience. Doctors rely on science, testing, and proof or evidence that it works. Belief does not replace diagnosis. You can respect culture, but your body runs on real-life biology that you need to be sure that this thing works before you do it. That is what doctors do. You see, culture is your identity, yes, but medicine is about survival, not identity. So when it's time to really meet someone, when you really need to know what works and what does not, for sure, then you meet your doctor. But when it is time to do culture and maybe enjoy the frivolities of culture, then you meet a traditionalist. Because let me explain something to you. How do doctors come to know that this drug will treat malaria or this drug will treat cancer? It's not by trial and error. They know because it is well documented. They have tested it many times on many people. We call it controlled clinical trials. So they are not guessing. They know this drug, it treats malaria. But then, the traditionalists, what do they have? A drug that treats many things. How do they know which one treats malaria? So you find that traditional medicine is a lot of guesswork going on, is a lot of hope, and then they will say you should have faith. Faith? No, sir. When I'm flying an airplane, for instance, as a pilot, who do you hand your life to? Who is sure that, okay, this thing I'm going to press, it will work? Or the person that will say, have faith that we land this thing safely. You get the point. Look, guys, let me tell you 5 reasons you should go to a herbalist. Yes, I'm a medical personnel, but here are 5 reasons you should go to a herbalist. Number 1, they don't do diagnosis. What they do is guesswork. No dosage, just drink until you feel something on your inside. There's no side effect, no accountability in case something goes wrong. You can't sue him in case he messes up, right? There's no emergency. He can't say, okay, let's say this person is dying now. He will now bring IV, bring all these things, bring defibrillator and try to revive you. No, there's no emergency like that. So if somebody loses consciousness, the person can die from there. They will blame the spirits. Now tell me, does that sound safe to you? Health is not a gamble, so think twice. Number 6, spiritual problems versus medical problems. See, not every sickness is spiritual, and even spiritual people need hospitals. Faith and medicine are not enemies. If you believe God heals, remember God also gave knowledge to doctors and therapists. You don't pray away fracture, do you? You don't cast away stroke or fast it away. No. So pray, yes, but prioritize medical care. Faith and treatment work together. Many of your pastors are going for medical checkup. Many of them fly out for medical treatment. Don't be left alone. Number 7, why you should stop going to hospital. Yes, I'm a medical personnel, but this is the reason why you should stop going to hospitals. Number 1, you should go where there are no tests. Go to traditional centers where nobody will test your body to know what is wrong with you. Nobody checks your blood pressure. Where nobody is accountable if you die. Where there is no follow-up. Now that is exactly the reason why hospitals exist, to prevent preventable death. Because people do not realize that hospitals have structure. That structure, the fact that there is a senior, there is a junior, they are working, everything they do must be written down, must be documented on the laptop. This is what I did, sir. Because in the future, it helps for accountability. Then also, it also helps to progress medicine. You are dealing with people that studied for so many years in order to be able to just come and speak with you and understand your sickness. You're dealing with people that have consequences if they misdiagnose you. Many places they can be sued. They can lose that license. This is very important. The traditional people, how many can lose their license? You don't understand. Your life is is a play to you. So who do you want to entrust your life to? Someone that has a lot to lose if he misses it, or someone that anything happens. So anyway, why are young people in Nigeria having high blood pressure? See, let me tell you something. You see stress, you see poor sleep, you see energy drink, you see smoking and heavy salt diets in burger and all those things. Even if you are a young person and you are not 80 yet, these things can give you high blood pressure even before getting to 50 years old. See, we are young, but when you live like your body is indestructible, high blood pressure happens. And guess what? It's a silent thing. So I think you should check yours. The average youth today has the level of pressure that people in their 40s and 50s used to have before. Thanks to social media. This is not ordinary. This is not normal. Today, for the first time, you are comparing yourself with people that have worked for 20 years and 30 years. And it's not like you are making progress with the level of pressure you have. You are just still where you are. Still learning the same skill you are learning. Still getting the same jobs you are getting. But the pressure, the comparison, the sleeplessness is getting higher ×2. That kind of exposure to things that you shouldn't have seen, pressures that you shouldn't have known, has an impact on your health, whether you believe it or not. I had a lot of young guys Your blood pressure is at 150, 160. There's even one I recorded 170, systolic, the upper one, right? And this guy used to have headaches. If this guy had not been careful, he would have had stroke at 29. So guys, let's be taking it JJ. Life is one. Our bodies were not meant for the level of high traffic and high pressure and high information that we have now, thanks to civilization, Sha. Please go and check your blood pressure. Number 9 is why some people never fully recover from stroke. Many times you guys ask me, but I've been going for physiotherapy for how many months now? I've not seen any results. Why have I not fully recovered? Well, there are 3 main things that could cause that. Number 1 is late treatment. Number 2 is wrong treatment. And number 3 is no treatment at all. Stroke recovery is time dependent. You see, the brain needs guided relearning. So when you delay your treatment or ignore it completely, your recovery is limited. See, the best time to recover from stroke is the first 3 months. You have a window period. That first 3 months is the best time to recover. Most times after 3 months, then your recovery is very slow compared to what it would have been. So when people ask, well, what's going on? This could be the reason. Many times Nigerians would have gone to traditional herbal centers, traditional this, traditional that, drank all manner of concoctions, and then it's already 3 years after stroke. Then they start coming for treatment. The recovery is not going to be the same. Some other people totally avoid it. They say they might be confused because they don't know who to believe. That's why I'm here to tell you who to believe. You need treatment, physiotherapy. You need medical treatment. This is also another reason some people don't fully recover. And lastly, there are people that don't even go for treatment at all. They don't fully recover. But if you go for treatment as at when due, oh my God, this is well documented. Treatment and recovery are pari passu. They are friends. And number 10, do you still need physiotherapy after 2 years of stroke? Well, so let's say stroke happened 2 years ago. So do you still need physiotherapy? Yes. The brain can relearn at any time. So progress may be slower, but function can still improve. The strength of your muscles, the balance, working, independence. It's never too late to get better. The brain adapts when challenged correctly. So someone here wants to understand what exactly happens with stroke, especially why that massage thing doesn't work. I'll tell you. You see, stroke simply means that the brain did not receive enough oxygen. So the brain has tissues or cells, just like here. So if it doesn't receive enough oxygen, which is usually in the blood, let's say blood didn't flow well to that area, the oxygen supply is cut off or reduced. That leads to a stroke. Stroke is like cell death. Stroke is like the tissue dies. And the brain is very delicate, so it doesn't recover from death, just like, unlike other cells in the body. If this cell here dies, let's say something happens, it becomes a scar. It falls off, new ones will just come and replace it. Unlike the brain, it doesn't like fall off and new one will come, no. However, the brain has what we call neuroplasticity. Neuroplasticity simply means the ability of a part of the brain to take over the function of the other part of the brain. That is the basis of treatment of stroke. In stroke, you are not trying to make the brain to heal. You are not trying to make the hand to heal. You are trying to teach the other side of the brain that has not been damaged to take over the function of the damaged part. That is the simple reality. That is why I said, if you are massaging a hand, what are you doing? That is not the way the movement works. But if you tell the person to raise his hand up 10 times or 30 times, you are teaching the brain, okay, this is the movement you have forgotten. And if the person is doing it like this first, by the time he's going to the 30th time or multiple times, you'll see that the person is now doing the movement well. What happened? As you were guiding the person in that movement, the brain was learning how to do it again. And that is how physiotherapists treat stroke. There are many other aspects to it. So stroke is not something that happened on the hands, on the legs. No, stroke is something that happened in the brain. And therefore, you must re-educate the brain on how to perform those functions.